Glutathione is the master antioxidant. And if you have an autoimmune condition, I strongly advise that you get glutathione. In this video, we're going to share with you how glutathione works and how you feel after getting it. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root cause without any harmful drugs or surgery. Make sure to subscribe for more videos like this one. Okay, let's jump in. Let's start with what glutathione is. So glutathione is 3 amino acids that are attached together. It's a natural substance that is made in our body. The 3 amino acids that it's made up of is cysteine, glutamine, and glycine. You can't take these separately. That's not glutathione. Now, those substances can help you produce glutathione, but it's not glutathione. So those 3 substances have to be put together in the body, and it makes this fabulous substance, glutathione. And it's something our body naturally makes. It's a strong antioxidant, great detoxifier, and we can't live without it. Can you get enough glutathione if you're just eating a good, nutritious, protein-based diet? For majority of people, yes, if you are like 40 and younger. Once you start getting older, your body starts getting more depleted of glutathione. Now, you'll still be functional, but you're not going to have the great anti-aging properties that come along with glutathione. A lot of chronic disease is related to oxidative stress. Glutathione is our master antioxidant. It's going to decrease that oxidative stress. And one big reason why a lot of us are getting more sick when we get older and we get all these chronic illnesses, cardiovascular disease, diabetes, cancer, etc., is because of this oxidative stress. That's the big underlying culprit of all these diseases. So, in my opinion, if you're eating a good, healthy diet and you're 40 and older, you're probably not going to be getting enough glutathione that's actually going to have the anti-aging effects that we want. So if you want to have good anti-aging effects, I would recommend supplementing with probably some glutathione or a substance that helps increase your own glutathione. So let's talk about how glutathione helps with autoimmune conditions. So glutathione, all patients that have autoimmune disease are low in glutathione. It's a chronic inflammatory state. It's causing a ton of oxidative damage, and your body just starts burning the glutathione up because it's trying to fix all these issues going on. All my patients get glutathione because what is it doing? So glutathione, like I said, is an antioxidant. Antioxidants are going to decrease the oxidative stress. That's a fancy way of saying the damage that the autoimmune condition is doing is that oxidative stress. So it's going to decrease that damage and trauma in an inflammatory state. So let's say you have rheumatoid arthritis, it's going to help decrease that trauma that's happening into your joints. And say you have Crohn's disease, it's going to decrease that trauma that's happening in your small and a little bit of your large intestine. So that's one piece of it. It also helps decrease a lot of the causes of autoimmune disease. It's a great detoxifier. So it's going to help us detox through our liver and our kidneys. So it's going to pull out a lot of the gunk that we're exposed to. So it's going to help pull out the heavy metals, the glyphosate, the pesticides, the herbicides, the solvents, on and on, all these things that we get exposed to that can make your immune system hyper irritable and cause autoimmune disease. So this helps eliminate all that junk. It also helps cellular metabolism and help our body eliminate all the cellular toxins. So our cells can stop working appropriately and they can build up a ton of toxins. And this has happened from toxins, but also the toxins build up because of toxins. So it's a combination. So glutathione helps take away the outside of the cell toxins, but it also helps eliminate the toxins inside the cell to help the cell function appropriately. It also helps heal the mitochondria. Most patients with autoimmune condition don't have their mitochondria working like they should. So it helps the mitochondria function better because it helps heal it and decrease that inflammation of the mitochondria membrane. So as you're getting a good idea, it's really one of my favorite substances for autoimmune conditions because it's treating so many different things. It's decreasing inflammation, it's decreasing oxidative stress, it's helping our detox appropriately, and it's helping our cells work better by healing the mitochondria. So it's going to be hard to really get over your autoimmune condition and really treat the causes without having enough glutathione. What is the best way to take glutathione? So there's several different ways I like glutathione to be taken. The most absorbable, the most potent way is IV glutathione. If you have an autoimmune condition, I really do recommend IV glutathione. Going to a doctor that actually is educated how to do this appropriately, because this is going to be so much more potent than an oral glutathione, and we're able to get much higher doses in there and really get all those processes working right that we just discussed about the benefits of glutathione. But secondarily, I do always prescribe some oral glutathione, and it needs to be in a liposomal form because glutathione is really hard to absorb. So we talked about like it's 3 different amino acids. Now, if you're someone that doesn't digest amino acids very well, maybe you're going to get glutathione okay without a liposomal form. But if you digest your amino acids just fine, like you should, you're going to break down that glutathione, split it up into its 3 different amino acids. Now, you might absorb those and maybe they're made into glutathione, but your body's not going to necessarily know what it's going to do and make glutathione. It's going to be used all over the body. So you're not going to get great amounts of glutathione if you don't take it in a liposomal form. So liposomal, it's in a liposphere, means it's going to get absorbed into your lymphatics in your stomach and get absorbed much more readily and bypass all those digestive juices so they don't get as damaged and broken down. So you're able to get that glutathione into your body appropriately. So those are the 2 ways: liposomal for oral, and then IV glutathione, really effective if you really are dealing with a chronic illness like autoimmune disease. Let's talk about substances that can be great on increasing glutathione. NAC is one of those. It has cysteine in it, and I love it to make glutathione. I also love it for one other thing, is it helps decrease glutamate. Glutamate is a big piece in inflammation, especially inflammation in the brain. So like in multiple sclerosis, I love NAC. I probably orally prefer NAC for that specific condition over oral glutathione because it's helping remove that glutamate, which is pro-inflammatory, but it also is helping provide that glutathione production that we need in our liver. Glutamine helps with this. Glycine helps with making glutathione production. Turmeric and milk thistle or some herbs that are really effective on increasing glutathione also. How often someone should get an IV nutrient bag with some glutathione if they want to treat an autoimmune condition or they want some anti-aging effect. So for autoimmune condition, in the very beginning, I'm doing it twice a week for about 8 weeks. That's usually sufficient. Sometimes we do it up to 3 months or so, depends on the person, but that's typically sufficient. And then we put them on a maintenance protocol. Maybe we're doing it every 2 weeks for about 3 months, and then we're seeing how they're doing. And then we're maybe doing it every 3 months, 4 months, 6 months, depending on what they need. Many times people are coming in and getting a IV nutrient glutathione with every 3 months or so. So let's say you're just doing it for anti-aging and you really want to be gung-ho. My recommendation is coming in and getting IV glutathione every 2 to 4 weeks if you really want to get your glutathione stores high and really be proactive at the anti-aging protocol. If you really aren't that proactive, you just want some of the benefit, I have patients coming in every 2 months to get IV glutathione. So let's talk about like the IVs that I do. We do various IV infusions in my office that me and my doctors formulate together to really benefit our patients. So like with glutathione, you might go to another clinic and just get glutathione, but you're not getting the cofactors. Glutathione only lasts in your body for about 30 minutes. And we like to give a nutrient bag before the glutathione that has the specific nutrients that we want in there, has the right amount of vitamin C and the magnesium and the zinc to help the glutathione be recirculated and remade. So you have it in there, it's doing what it's doing, then it gets remade and remade. So it stays in the body much longer and doing the effects for a much longer time when we do it that way. So you want to go to a doctor that knows what they're doing, that they're formulating it appropriately. They've received extensive training of how to make glutathione work best in their body. And that's what we've done here at our clinic. Glutathione is just one of the IVs we do. We do various other IVs and tailor it to each patient's needs. So let's say you want to get a hold of me, you want some help with your autoimmune condition, visit my website, integrativemedica.com, find my phone number there, give my receptionist a call. You can set up an appointment with me or some of my other awesome doctors that we have. You also could book it directly online. You don't have to be here in person. We could also just do it virtually. If you want to learn more about autoimmune condition, click my videos to the right. I'm Dr. Jake, and I'll see you there.